Let's take you live to the UN General Assembly. President Cyril Ramaphosa is currently speaking.
Session of the UN General Assembly is an opportunity to take stock and to sit back and think about what we can do. It is also an opportunity to agree on bold steps that need to be taken to accelerate the actions that are needed to achieve the Sustainable Development Goals that are related to women's, children's, and adolescent health and well-being. The Global Leaders Network is an opportunity for heads of state and government and other leaders to work together to champion the women, children, and adolescent agenda. I'd like to thank many leaders who I wrote to, who responded very warmly, and who have said that they will be willing to be part of this. Now, as heads of states, we can provide leadership and inspire ambitious action. We have the convening power to mobilize our peers and advance policies. We can also advance programs and financing initiatives for improved outcomes as well. The leaders of the G20 countries are particularly well placed to advance progress to the most vulnerable women, children, and adolescents as well. Having just convened in South Africa the BRICS Summit, which was joined by a number of other countries, this is another area of work that we are going to be focusing on. So we are going to be mobilizing additional countries and additional heads of state to be part of this initiative. As part of our agenda, we must challenge the disregard in many communities and countries for the sexual and reproductive health and the rights of women. We must also ensure that these issues are openly discussed and that they are openly and directly addressed as well. To advance these rights, to improve women's sexual and reproductive health, we have to end gender-based violence. The World Bank has reported that nearly a third of women around the world have experienced intimate partner violence or non-partner sexual violence. Now, this is a staggering number. It is now more than evident that countries must reduce inequality in access to healthcare. The inequality is catastrophic to economic, political stability, health security, and human rights. Political leadership means both action and accountability. It involves the will to make the deliberate policy decisions to accelerate progress for women, children, and adolescents. It basically means that as countries, we do need to put the issues of women and children on the front of the agenda. Effective leadership champions collaboration to strengthen health and related sectors and to engage women and children meaningfully in health systems and their reform. In many countries, international donor financing for health is waning and is hugely fragmented as well. This is compounded by the diversion of domestic funding away from women's, children's, and adolescents' health in response to the COVID-19 pandemic and a number of other priorities that countries are focusing on, or donors are focusing on. The poor economic outlook and limited fiscal space in many countries heightens this challenge. Already a number of countries, particularly in the low-income countries, are reeling under the burden of debt and are calling out for the reform of the global financial system or architecture so that they can access finance to address huge social challenges that they face. So investing in interventions for women, children and adolescent health yields social and economic benefits to continue throughout life and for generations to come. If between now and 2035 we were to invest just $5 per person per year in health systems and high-impact health interventions for women and children in high-burdened countries, the value of the economic and social benefits would be 9 times greater than that amount. Now, every dollar invested in child immunization, for instance, brings in at least $20 in benefits, and every dollar invested in selected adolescent health interventions yields a 10-fold return in health, social, and economic benefits as well. Now, the Global Leaders Network will advocate for sustained and enhanced financial investments, contributing to the growth of nations and enabling individuals to reach their highest potential in every country. We will also advocate for improved alignment of global financing mechanisms to foster better investment in strategic priorities in countries, to meet the health and well-being needs of women, children, and adolescents. Close monitoring and accountability across national, regional, and global platforms is therefore essential. Now, as governments, we can share the models being implemented in other countries and exchange best practice, because a number of other countries are doing rather better in this regard. We therefore need to share those models. As South Africa, for example, we have made important strides in areas of healthcare. New HIV infections decreased by 48% between 2010 and 2019 as the country expanded its HIV treatment and voluntary medical male circumcision. And the male circumcision one has been a phenomenal success. And we would wish that many other countries do also follow or study this type of model. We remain committed to implementing universal health care through the establishment of the National Health Insurance, which will have far-reaching benefits for the access to health services for women, children, and adolescents. And in this regard, we are hugely inspired by what Nelson Mandela did when he became president of our country and decided that pregnant women and young children should have free medical care. And that has continued to be the trajectory of our country throughout. So this has inspired us as successive governments, and now we are on the cusp of implementing universal health coverage. I'm certain that this will be the joint stewardship of the global leaders, supported by the Partnership for Maternal, Newborn and Child Health and other champions. We stand a far better chance of delivering on our promise to women, children and adolescents across the world. And as you correctly said, this is a promise that we should do everything to meet, because in the end, the real better future of the world depends on what we do in the interests of women, children and adolescents. I thank you very much for being here, and I look forward to the engagement that we will have. Thank you very much.
Well, thank you, President Ramaphosa, for that wonderful speech and for your leadership and deep understanding of the issues and challenges we're facing here, the structural inequalities, the denial of
President Cyril Ramaphosa speaking there at the UN General Assembly in the United States. He was talking mostly about healthcare in the global front and how it needs to improve.